Hey there, classmates. For my Module 7 video, I'm doing on the EMS related topic how-to video. I chose report writing, EMS report writing. As with anything that we do, documentation is very important, especially in patient care reports. One way to do a patient care report is by using the SOAP format. SOAP stands for Subjective, Objective, Assessment, and Plan. In the S, or the subjective section, you want to document the patient's age and gender. Next, you want to quote the patient's chief complaint, the reason they called us, the reason they called 911, and you want to put it exactly how the patient tells you. You can use the mnemonic SAMPLE, which stands for signs and symptoms, allergies to medications, medications that are prescribed to the patient, the last oral intake, and the events leading up to the onset of the chief complaint. If the patient is complaining of pain, you can also use OPQRST to help you remember to ask the appropriate questions. And that stands for onset of events, what they were doing, which is what they were doing when the pain began, provocation, or whether anything makes the pain better or worse. Q for quality of pain, have the patient describe the pain to you, tearing, crushing, stabbing. R is region and radiation, where the pain is and does it radiate anywhere. S would be severity. You can have the patient rate the pain on a scale of 1 to 10, 10 being the worst pain they've ever felt in their life. And T is time. How long has the patient had the pain and any changes in the pain. After that, you would want to include any pertinent negatives, such as patient denies loss of consciousness if it's a fall injury, if they have, they deny chest pain, a female who denies pregnancy, and an MVA or abdominal pain. In the O, or the objective section, you want to include your initial impression of the patient, such as where you found them and in what position. Supine on the floor, supine on the couch, sitting on the couch, talking to you. You would also include their Glasgow and their orientation. Next, you would include a full head-to-toe assessment. You want to make sure it's detailed. At the end of that section, you would include the condition of the patient's vehicle. If it happened to be from a motor vehicle accident, you want to just put in your report if it was heavy damage, moderate damage, minor, the condition of the steering wheel if the patient was the driver, the condition of the windshield if they were unrestrained, whether or not they were restrained, airbag deployment, and basically just where the damage is. Any of that would be able to help the further patient care in the hospital. And the next section would be A, or the assessment section. That would be your diagnosis. Basically your diagnostic conclusion based on the patient's chief complaint and your physical exam findings. That's the route you took to treat the patient, or what you went with. And the last section, which is the P, that stands for plan. You want to make this section the chronological order of events from arrival on scene all the way to the end of the call when you transferred care to the ER nurse or to air rescue. You would want to, in this section, you would want to make sure you include the full description of what was done for the patient and how they responded to it, and whether or not their condition improved or got worse. So if you gave them a medication and their mentation got better, you gave them some pain management and it worked, or whether they deteriorated with whatever your treatment was that you did for them. Just want to make sure you document everything. Lastly, you would want to include the ER room number that you left the patient in, who you transferred patient care to, and where you left their belongings, such as a purse, jewelry, clothes, medications, anything that you brought with them, their walker, their wheelchair. So at the end, patient care reports are a very important part of our job, and they should be thorough. At the end of the day, if you did not document it, you did not do it. I hope this was useful.